there's something that bothers me these days, and that is the rate of pancreatic cancer in India seems to be rising. And if we were to look at trends in other countries which are more developed than us, in a way we are mimicking what is happening in developed world, right? You can see that pancreatic cancer in most highly developed countries, the rates are rising rapidly. And I do see a similar trend in India too. Well, for that matter, in Kerala. A lot of young persons, individuals, are now getting diagnosed with pancreatic cancer. And when I think about it, sometimes there are ways you can diagnose pancreatic cancer a bit early than when it actually gets to stage 4. Systematic screening is not a solution. By that I mean screening using a blood test in the absence of any symptoms is not a right solution for pancreatic cancer. So what can we do? I think focused screening sometimes can help identify a person with pancreatic cancer before they actually develop a symptom related to pancreatic cancer directly, like abdominal pain or jaundice. So what is that sign or symptom that sometimes, if you pay close attention, will help you diagnose pancreatic cancer a little early? And that is blood glucose. If you look at published literature, scientific research, new onset diabetes can sometimes portend a diagnosis of pancreatic cancer. I do not say that all new diagnosis of diabetes patients must undergo further testing to rule out pancreatic cancer, but there are some warning signs. What are they? If you have a patient who has a new onset diabetes, and that diabetes is actually quite brittle, which means very poor glycemic control in a rapid manner, rapid weight loss, unintentional weight loss, significant amounts, poor appetite, lean body habitus, they're not the typical metabolic syndrome kind of patient, but developing brittle diabetes. No family history of diabetes, but developing new onset diabetes after the age of 50 or so. Now, these are the sort of patients who you should think about pancreatic cancer. And these are the sort of patients who may benefit from getting an ultrasound or a CT scan or an MRI scan of the abdomen to look for pancreatic mass. I'm not saying all newly diagnosed diabetes patients should undergo such testing, but there are some high risk settings where it is acceptable to do a focused screening for cancer of the pancreas in newly diagnosed diabetes patients. So as a doctor, if you are thinking about ways to catch cancer a little bit too early, this is one avenue where you can use in your practice. I hope this helps you. Increasingly in the coming days and months, we are going to see more pancreatic cancer, unfortunately. The reasons are unknown, but I suspect it has to do something related to why colorectal cancers are rising in the young, why breast cancers are rising in the young. And that could be the fact that such cancers have a lifestyle component to it. Bad diet, bad lifestyle, high stress, processed food consumption, all of this is eventually taking a toll on our society. Take care and God bless you.